Good evening, graduates, family, friends, distinguished guests, faculty, and staff. My name is Dr. Kimberly Brown. I'm the Dean for the Roanoke campus for Galen College of Nursing. It's my pleasure to welcome you here to our ceremony tonight. Today's event is one that our graduates have looked forward to for quite some time. Our graduates have been engaged in rigorous study while maintaining full-time employment and raising families. Persistence has been the key to their success. Now they can say that they have taken all of their finals and they're ready to sit for the NCLEX exam. Today we celebrate their accomplishments and their perseverance. Family and friends, you have experienced secondhand the trials, the tribulations, and the tears that come with nursing school. Nursing is one of the most rigorous programs of study on any college campus in the United States. There is no secret to success in nursing school. Success in nursing school comes from developing strong academic skills, dedicating oneself to study, showing up on days when motivation is low, and believing in what is possible, not what is easy. I would like to add that this particular student group has demonstrated high integrity, significant commitment to the journey, and they've all navigated different speed bumps and delays along the way, and we are so proud of you. We want you to know that. Now, on behalf of the Board of Directors, administration, faculty, and staff of Galen College of Nursing, I would like to welcome you to the fourth commencement of the Roanoke campus. Tonight I have the honor of introducing our speaker, Devin LaPoisa. Devin has more than 15 years of professional experience, most recently serving as the Director of Emergency Services since 2022. Devin is a graduate of the HCA Director Development Program, where she served as Associate Director of the ED at Lewis-Gale Medical Center. During her time at Lewis-Gale Medical Center, she led the implementation of the provider-only care model responsible for reducing their low acuity length of stay. Prior to that, she was the Emergency Department Clinical Coordinator for 5 years and began her career as nursing assistant on the ortho floor before becoming an RN. As a leader, Devin's accomplishments include employee engagement and scores being improved, driving strong employee retention, and helping to promote a culture of belonging. Devin is committed to her team, and she is truly passionate about developing and promoting her staff. Her leadership contributed to patient experience scores in the top 10 emergency rooms within HCA in 2023. She has also been selected to train new directors, managers, and CNC across the division. Please help me welcome Devin LaPoisa.
Thank you, Dr. Brown. I appreciate that warm introduction. So I am Devin LaPoisa. I currently get the pleasure of serving as the Chief Nursing Officer at Lewis-Gale Hospital, Montgomery. As Dr. Brown said, I've been a nurse for 15 years and in my current role for just over a year. I started my nursing journey in pediatric inpatient behavioral health and then moved into the emergency department space. I stepped into nursing leadership 9 years ago and have found a passion for being able to lead those providing the direct patient care. My goal as a leader is to leave this nursing profession in a better place than I found it, and my focus every day is to improve the lives of our caregivers. My journey through nursing has had many different shapes, and I'm privileged to be in my current role and to be able to lead the nursing profession at this level. To the faculty and staff of Galen College, to the proud families and friends who helped make this day possible, and most importantly to this graduating class, thank you for inviting me to share in this milestone moment. As a CNO, I get the privilege to see nursing from many different angles: clinical, strategic, operational, and no matter where I travel in my career, I always come back to the foundation, what it truly means to be a nurse. And nothing compares to the electricity of the moment you are having today here at nursing school graduation You'll always remember this day. And you are stepping into one of the most sacred professions. So, here we are. You have learned all the things. You have devoted countless hours to studying, practicing, and honing your technical skills of nursing, all in the pursuit of the calling to care for others with compassion, dignity, and unwavering commitment. These technical skills are your foundation. It is now time to expand those skills into what we call our soft skills. Adaptability, resiliency, communication, empathy, and abundant compassion are key, especially through this next year in your nursing profession. Nursing is diverse and dynamic. You'll go from caring to a terminally ill patient to a post-surgical patient, right into a behavioral health emergency, maybe even fighting off fires, depending on what's going on, literal and figurative. The soft skills will be your underpinning in every interaction and decision made in the care of our patients. It is what elevates the care that we render and the patient's perception of that care. So early on in my career in the emergency department, I had received word that a patient was en route to our department after a serious motor vehicle collision on the interstate. I was still a fairly new nurse, trying to find my rhythm and learning to balance clinical skill with human instincts. The patient was just arriving to my room, and he was about my age, newly married, and just starting out his life. When the EMS crew arrived, they shared with us that the patient's spouse, who had also been in the car, had not survived the accident. The patient was relatively stable physically, very flat, detached, in shock, and we began the process of cleaning his wounds, assessing those injuries, and the patient shared with me something unexpected. He had shared that there had also been a dog in the car, their dog. He had been scared and he bolted from the scene and was eventually taken to a local animal shelter. In that moment, I knew this was not just about lacerations or vital signs or imaging. This person's entire world had changed in just a moment. They had lost everything, except maybe this dog, who was family. So I went to the shelter. No protocol or policy, no form, no permission slip. I just knew what I needed to do and what needed to happen. I picked up the dog and brought him back into the ER to be with his owner. And for the first time since arriving, something shifted in that patient's eyes, a connection to life, however small. And that moment taught me more about nursing than any class ever could. Because at its core, nursing is about seeing the whole person. It's not about understanding that patients are purely a diagnosis. They have stories and they are in motion. Sometimes healing doesn't come from medicine. Many times it just comes from presence. Noticing the one thing that might bring a light in a very dark day and then being brave enough to act on it. You've already proven that you can study, work hard, and be committed. You've shown up for clinicals, you've survived exams, and soon, or maybe already, you will pass your boards. But from here on out, the challenge will shift. Your work now becomes about staying human in the face of complexity. I think compassion and empathy are beautifully summarized by the American poet Walt Whitman. He says, "I do not ask the wounded person how he feels. I myself become the wounded person." Walt Whitman is mostly known as a poet, and he found himself deeply affected by the profound suffering that he witnessed during the Civil War. He witnessed devastation and human toll of the conflict, and he felt compelled to act. So then, rather than remaining a distant observer, he chose to immerse himself directly in the care of wounded soldiers, ultimately becoming a volunteer nurse. Whitman's decision to become a nurse in the Civil War was an expression of his empathy, compassion, and sense of duty to fellow human beings. He felt a calling to alleviate the physical and emotional pain of the wounded and dying. During his time as a nurse, Whitman worked primarily in Washington, D.C. and Virginia, providing comfort, companionship, and practical assistance to wounded, oftentimes sitting by their bedsides, listening to their stories, writing down the soldiers' messages to their families with the assurance of delivery. Whitman's experience as a nurse influenced his poetry and worldview. Through his interactions with soldiers, he gained understanding of the universal human experience of suffering, resilience, and the fragility of life. He had no clinical training, but he understood something more important, that to truly care for someone, you must meet them where they are. You have to step into their world, become the wounded, even if only for a moment. And that's the kind of nurse we need now more than ever. Nursing isn't just a profession, it's a radical act of empathy in a world that desperately needs it. Whitman described his time as a nurse as the greatest privilege and satisfaction, and of course, the most profound lesson of my life, and I hope the same for all of you. Nursing certainly wasn't the easy choice for you to make when you decided on a career path. There are going to be days that stretch you, frustrate you, exhaust you, but there will also be days that fill you to the brim with meaning. So I will leave you with 3 things that I hope you carry with you. 1, let your compassion be louder than your fear. You are ready, even when it doesn't feel like it. Trust your instincts, lean into your training, and let empathy guide you when the path is not clear. 2, lead from wherever you are. Leadership isn't about a title, it's about influence. It's about the way you show up for your patients, your team, and for yourself. And 3, stay connected to your why. You didn't choose this path by accident. Something in you was drawn to care, to comfort, to serve. You have made it. This day you have thought about, worried would never come, anticipated. It is here and you have done it. What a remarkable milestone you have achieved and get to celebrate. And before you get too far into the weekend of celebrations, I hope you take a moment to sit with this accomplishment. Graduates, you are the future of our profession, and we need you. Not just your knowledge, not just your skills, but your humanity. So go forth and become the wounded person, find the courage to go get the dog, and the communities around us await your extraordinary contributions. Congratulations. And I get the pleasure of announcing and welcoming our next speakers, Amanda Hodges and Daphne Amos, to start our presentation of special awards.
Thank you. We are honored to have you here today. Our first award is the Emerging Leader Award. Catherine Mershon personifies a standard of excellence that places her among the top leaders in the profession. She is the co-founder of our nursing program and is currently a member of the board of directors for Galen College of Nursing. Due to her reputation as a nursing leader and humanitarian, the Kathy Mershon Nursing Leadership Award was created to recognize a graduating student from the associate degree program who demonstrates the personal and professional qualities of leadership, resourcefulness, innovation, and excellence. The candidate is recommended for this award by both students and faculty. This student has established themselves as capable and compassionate leader amongst their cohort. They have been a consistent champion in the classroom and in clinical and have exhibited dedication to their coursework as well as to their peers. It is our pleasure to present the Kathy Mershon Nursing Leadership Award to Christy Arthur. Please welcome Tanya Robertson to present the Human Touch Award.
Congratulations, Christy. Our next award is the Human Touch Award. This award is dedicated to Dr. Marjorie Perrin, who was a dedicated nurse educator, co-founder of Galen College, and a member of the board of directors until her death in 2011. The Marjorie Perrin Essence of Nursing Human Touch Award is presented to a graduate student from the RN program. This award provides an opportunity to honor Dr. Perrin's legacy of nursing compassion and to recognize a Galen student who exemplifies the essence of nursing. The recipient is nominated by faculty and classmates who feel that they most embody the human touch in dealing with their patients and fellow nursing students. This student exemplifies the essence of the Human Touch Award through their unwavering compassion, empathy, and ability to make every patient and peer feel seen, heard, and valued. This instinctive kindness and emotional intelligence has set the student apart as a nurse who goes beyond clinical skill, bringing genuine comfort and connection to all. It is our pleasure to present the Marjorie Perrin Essence of Nursing Human Touch Award to Shelby Tillman. Congratulations, Shelby. Now please welcome Program Director Pam Lindsay to introduce our graduates and Daphne Amos to award diplomas.
Thank you, Tanya. Each pinner tonight is a faculty member from Galen College, chosen by their graduating student to signify the faculty's impact on the student's academic journey. Please welcome our pinners, Joe Grissetti, Kim May, Tanya Robinson, and Amanda Anderson. Please stand. Associate of Science in Nursing students, please rise. Christy Arthur. Todd Bibb. Shelby Dillman. Mariah Honecker. Robin Joliffe. Charity King. Nyasia Preston. Tiffany Vi. This concludes our RN students. Please welcome Julie McHugh Donahue for the ceremony of lights.
Thank you. We have a tradition in nursing education called the Ceremony of Lights. Through the Ceremony of Lights, the passing of one flame to another signifies the passing of knowledge and the acceptance of responsibilities and the rights and obligations of the nursing profession. We offer our pledge in this ceremony. I invite graduates, nursing faculty, and guests that are in the nursing profession to please stand. Okay. Students, you may light your lights. Okay. The Nightingale Pledge, named in honor of Florence Nightingale, is a statement of ethics and principles of the nursing profession. Lystra Gretter and a committee for the Farron Training School for Nurses in Detroit, Michigan, created the pledge in 1893, and it is a modified version of the Hippocratic Oath. The pledge can be found on page 2 in the commencement program. Please repeat each phrase after me. I solemnly pledge myself in the presence of this assembly.
I solemnly pledge myself in the presence of this assembly
To practice my profession with integrity.
to practice my profession with integrity.
I will endeavor to maintain and elevate
I will endeavor to maintain and elevate
nursing standards both as science and art.
nursing standards both as science and art.
I wholeheartedly recognize the importance
I wholeheartedly recognize the importance
of quality standard of care and of professional accountability.
of quality standards of care and personal accountability.
I will devote myself to the protection, healing, and welfare
I will devote myself to the protection, healing, and welfare
of those committed to my care.
of those committed to my care.
I will hold in confidence all personal matters
I will hold in confidence all personal matters
committed to my keeping and will respect
committed to my keeping and will respect
the privacy of medical information.
the privacy of medical information.
I accept a duty to work for the improvement of health
I accept the duty to work for the improvement of health
in the communities in which I live and work.
in the communities in which I live and work.
I will act with compassion in ethical matters.
I will act with compassion in ethical matters.
I will not take or knowingly administer any harmful substances.
I will not take or knowingly administer any harmful substances.
I commit to interdisciplinary collaboration and lifelong learning.
I commit to interdisciplinary collaboration and lifelong learning.
I fully acknowledge the seriousness
I truly acknowledge the seriousness
of the responsibility integral to the nursing profession
of the responsibility integral to the nursing profession
and the significance of the commitments I pledge today.
and the significance of the commitment I pledge today.
Thank you. You may turn off your lamps and have a seat. Please welcome Dean Brown for the presentation of graduates.
On behalf of Galen, I would like to take this moment to recognize our HCA partners. Please stand. We deeply appreciate your unwavering support and dedication to our students. Thank you. Now, all students wearing orange and blue cords, please stand. These students have decided to work as nurse residents at an HCA facility. You may be seated. Next, our student ambassadors and members of the Galen Student Nursing Association, please stand. These exceptional individuals have made a significant impact on our Galen community through their leadership, volunteerism, and dedicated service to their peers. Their contributions have not gone unnoticed, and we are profoundly grateful for their efforts. Thank you. I'll ask your peers to stand also. And I want you guys to turn and face your friends and family. Graduates, please give your friends and family a big round of applause for their love and support. Okay, please turn back and face me. Upon recommendation of the faculty and by the authority vested in me by the Galen Board of Directors, I confer upon each of you the respective academic degree for which you have been recommended with all the rights, privileges, responsibilities, and obligations appertaining thereunto. You may move your tassel from the right to the left, signifying completion of this step of your academic journey. I'd like to congratulate you because you are now alumni of Galen College of Nursing. Dear guests, after the students and the faculty process, we'd like to ask you to join us for a reception in their honor. Thank you.